Hey everyone, it is Dr. Cal Olson at Chiropractic First of Rockford, and today I want to share a thought of the week that we have here in the clinic. But really, it's almost more of like a mantra to what we do here in practice, and it's the idea that it's easier to maintain or establish and maintain health from childhood on than it is to try and fix a broken adult. And really, what that gets at is the idea of preventative or proactive healthcare versus crisis healthcare. Unfortunately, crisis healthcare is what a lot of our country and our society is geared around, where you would only go to the doctor when you have something that's going wrong, when you have a symptom that's already present, a pain, an ache, numbness or tingling, something like that. And so the doctor's job then is to determine what the problem is, what caused it, and do any necessary action in order to fix that. And to be clear, in an emergency situation, that's absolutely the way to address things if something happens with trauma or something like that. But many people would argue, or at least people that maybe are looking for a more holistic and proactive approach, is the idea that we should be doing things earlier on before those underlying injury causing actions are being taken. We should be proactively looking for ways to prevent those chronic things from building up to the point where we're in crisis, where we have to make a snap decision in an emergency room, or we need to start taking a medication for years or a lifetime medication just to get numbers down on a blood test, things like that. And so chiropractic and the philosophy that we utilize in our center, and one reason we're so passionate about seeing children of all ages, really from early on when they're asymptomatic and seemingly perfectly healthy, but want to maintain the health that they have. The reason that we have that mantra is because we believe firmly that that's what makes a better adulthood for that person. And so it's harder when somebody becomes an adult to, quote, fix those problems, because oftentimes they've built up a lifetime of scarring, of traumatic issues, of changing postures and behavior patterns, maybe psychological issues. There's all these underlying things that become much harder to fix when they've been a part of someone's life for years and years and years, versus a child who maybe hasn't established all those patterns in their daily living because they haven't lived enough, or they haven't had enough trauma or things like that. And so if you're somebody that is looking for proactive healthcare, not just for yourself, but looking, how can I affect my family members, and specifically the children that may be in your life, whether they're children or grandchildren, that you can help make those health decisions for, that mantra becomes very important. We believe firmly it is better to maintain a healthy childhood through adulthood than it is to try and fix a broken adult. Now, if the adult is broken and there are symptoms, of course, we're here for that as well. Well, with that, take that thought with you. Understand that it's better oftentimes, in order to establish those healthy relationships and those healthy actions, when they're symptomatic free and there's seemingly no health concerns. That's the time to be proactive. That's the time to act. That's the time to work with diet, with exercise, with chiropractic adjustments to make sure you're maintaining those going forward. Just a thought. Have a great day. We'll see you soon.